What are the emergency airway management protocols for plastic surgery? When it comes to plastic surgery, understanding emergency airway management protocols is crucial. These protocols are designed to ensure patient safety during procedures that may involve risks like facial trauma or airway swelling. The first step in any emergency airway situation is immediate assessment and oxygenation. Medical professionals must quickly evaluate the airway for any obstructions or compromises. This assessment often follows the channel principle, which considers factors such as potential cervical spine injuries or hematomas. If the patient is breathing spontaneously and stable, supplemental oxygen can be provided through a nasal cannula or a non-rebreather mask. However, if there are signs of hypoxemia or unstable breathing, bag valve mask ventilation is initiated to maintain oxygen levels. Next, airway evaluation is critical. Laryngoscopy helps determine how difficult intubation might be. The principle of de-escalation is applied here, meaning the simplest and least traumatic intubation method is chosen first. Video laryngoscopy is often preferred over direct laryngoscopy, as it provides better visualization, especially in challenging airways. It is important to avoid multiple blind intubation attempts to minimize trauma and swelling. Securing the airway is the next step. If rapid sequence intubation is possible, it should be done quickly to reduce the risk of aspiration. In cases where intubation is difficult or fails, supraglottic airway devices can serve as a temporary solution. If non-invasive methods do not work and oxygen levels cannot be maintained, more invasive procedures like cricothyroidotomy or tracheostomy may be necessary. Preparedness is key in these situations. An airway management cart should be stocked with all necessary equipment, including various airway adjuncts, suction devices, and a cricothyroidotomy kit. A multidisciplinary team approach is essential, involving anesthesiologists, surgeons, and emergency personnel trained in airway management. It is generally recommended to limit intubation attempts to avoid worsening airway trauma, typically no more than 3 attempts by the primary clinician and 1 by a secondary clinician. In plastic surgery, special considerations must be taken into account. Facial trauma, swelling, or surgical manipulation can complicate airway management. For example, mandibular fractures may require careful use of airway adjuncts. Post-operative airway edema can also necessitate extended monitoring and readiness for reintubation or emergency airway access. After extubating patients with difficult airways, using airway exchange catheters or supraglottic devices can facilitate rapid reintubation if necessary. Finally, post-procedure monitoring and debriefing are vital. Continuous monitoring of oxygenation and ventilation through pulse oximetry and capnography is essential. After managing a difficult airway, a team debrief is recommended to review the procedure and improve future protocols. In summary, emergency airway management in plastic surgery emphasizes early oxygenation, careful airway assessment, the use of the least invasive techniques, and a coordinated team effort to ensure patient safety. These protocols are tailored to address the unique challenges posed by facial anatomy and surgical interventions. Always consult healthcare professionals for personalized medical advice.